Taking the extra pounds off and keeping them off can be a challenge. Our guest today believes that obesity is a chronic medical condition and that patients struggling with it deserve medical treatment just like any other health problem. I'm Cheryl Martin, and on this episode of Hello Healthy, a Dignity Health podcast, our topic is obesity management. Our guest is Dr. Anila Chadha. Her specialty is non-surgical weight loss programs. Dr. Chadha, thanks for being on.
Thank you for having me.
The first question is, what is obesity?
Obesity is a chronic medical disease. I want to emphasize it's a chronic medical disease caused by complex interplay of hunger hormones, satiety hormones, our environment, and genetics. It is not merely calories in, calories out.
So, what are the health complications that come with obesity?
Obesity is central to many health complications. Number 1, high blood pressure, type 2 diabetes, obstructive sleep apnea, heart disease, stroke, early osteoarthritis of knees, polycystic ovarian disease. Many cancers, unfortunately, are linked to obesity.
So that's a perfect segue into the question, why is managing your weight so important?
Managing weight is extremely important because not only it is preventative, but also it improves the quality of life. It can prevent so many of the health problems that we see are becoming more and more prevalent in the United States. So if somebody manages weight and they are on their pathway to lose approximately 5 to 10% of their body weight, they can reverse their diabetes, they can reverse fatty liver, they can improve sleep apnea, their arthritis improves. There are so many health benefits of losing even 5 to 10% of body weight. And we can be at lower risk for approximately 15 types of cancers.
Wow. Now, doctor, when we talk about obesity, is there a particular weight range that when you know you've hit that you would be considered obese?
Yes. So obesity is measured by body mass index. Body mass index is a calculation between weight and height. When the body mass index is more than 30, we call it as obesity. Obesity is classified as mild, moderate, and severe. So 30 to 34.9 is called mild obesity, 35 to 39.9 is moderate, and more than 40 is severe obesity. There is one more parameter that we use for obesity, that is waist circumference. If the waist circumference for females is more than 35, then that is also categorized as obesity. And for males, it is 40 inches.
So is the goal to get out of the obesity range altogether, even mild?
Yes. Even for mild obesity, the goal is to be less than the body mass index of 30, preferably less than 25, actually.
Okay. So you've talked about this, that obesity is not just a matter of willpower or calories in and calories out. So what can cause obesity?
There are many contributing factors for obesity in one's life, starting from childhood. For example, for females, during menarche or when the menstrual cycle onset is there, to pregnancy, to menopause, all these can contribute to obesity. For in general population, sedentary lifestyle, any history of trauma, eating away from home. There are many hormone dysregulation problems that can contribute to hormone dysregulation in hypothalamus that ultimately contributes to obesity.
So is there medication to help you manage your weight?
There are many FDA-approved medications these days to help treat the disease of obesity. The number one is GLP-1 analogs. These medications were originally used for diabetes, but it was noticed that they are also helpful in losing weight because, as I said, obesity is central to these comorbidities like diabetes. So GLP-1 analogs are these days used the most common medications They come as injectables, but they are pretty doable for patients, weekly or daily. Then the other ones are appetite suppressants, which suppress the appetite so that our body does not give abnormal signaling that a person is hungry, and by virtue of that, they lose weight. Then we have medications which target towards emotional eating and cravings.
So if surgery is needed and those medications are not working, what are the options?
Now, surgery is an excellent option. These days, the weight loss surgery is called metabolic surgery because it has been seen that surgery has many metabolic advantages and benefits for obesity and its comorbidities. The most common surgery done these days is gastric sleeve surgery or gastric bypass surgery. Gastric sleeve surgery is recommended whenever there is body mass index of more than 35 along with obesity-related disease. For example, somebody has body mass index of 37 and they have diabetes, they can get metabolic surgery and their diabetes can actually reverse. Similarly, anybody who has body mass index of more than 40, surgery is excellent choice for them because it improves the life expectancy by 7 years. It improves the quality of life in 89% of the people.
Wow. Is there anything else you wanted to add that we did not cover?
If you or your family member are struggling from obesity, recognize that this is not your fault. It is a chronic disease. It needs to be treated. There are many obesity medicine physicians who treat obesity as a disease, and there's so much help out there.
Dr. Anila Chadha, thanks for explaining obesity and educating us on some of the non-surgical ways for managing our weight. To learn more, visit dignityhealth.org/Bakersfield. If you found this podcast helpful, please share it on your social channels and be sure to check out the podcast library for other topics of interest to you. Thanks for listening to this episode of Hello Healthy, a Dignity Health podcast.